So if you could please explain again how many students will be allowed in the average classroom to ensure safety, because there's a lot of confusion about the pods and the protocols around that.
Yeah, so Marcella, my job is to provide the parameters, and we have done that with a whole group of teachers, parent groups, superintendents, principals, the Ministry of Education, and we've been involved from the very beginning of putting out the parameters of how schools can operate safely. And then it depends on every single school. So that is the work that has been happening. We know, and I've talked to many parents and teachers and principals and superintendents, and I got a great opportunity to talk to a lot of kids last week as well. So every school will be slightly different. It's like what we did for restaurants, for example, where we put out the parameters and the restaurants came and said, this is how we'll make it work in our setting, in our situation. So I can't tell you exactly what the number is going to be in every class. It'll depend on the school, it'll depend on the age of the kids, but we do have parameters, and the maximum number that children and teachers, so the maximum number includes both children and teachers, for elementary school is up to 60 that they might have distance contact with within a year or a semester. So that's not every day I'm going to be in close contact. We still have our physical distancing measures in place. We still have things like staggered times. For example, different classes may go out to recess together if they're in the same learning group, but they'll be in different parts of the schoolyard. They may have lunches at the same time, but in different areas. So the layers are still there, but the details need to be worked out within every single school in every school district, and that's the work that's been going on. I know there's a lot of really great innovative things that people have been doing to make this work, recognizing how important it is for our children across the board to get the education plus the social interaction of the school setting that they need right now. And we know that. We've seen the data from here and from around the world, the negative impacts that have happened with schools closing. So that's what we're focusing on. There'll be more details coming out later this week as the plans have come in from the different school districts and different schools. And I look forward to all those parents, and we're all anxious. Of course we are. We need to learn how to live with this virus, and we in public health will be supporting doing that and making sure that those layers of protection are in place in our schools. So ventilation is, of course, something that we see is really effective. We know that if you're outside, the risk of transmission is considerably less than inside, even if you're having contact with people. It's not zero, but it's much less risky outside. And we've said that from the very beginning, where we've encouraged people to go outside. Maintain your distance, but go outside. We know that it's the virus is destroyed by UV light. We know that natural ventilation, so being able to open windows in schools, obviously not always possible, but those are things that can help disperse any virus that might be there, so that it is not concentrated enough that it can infect people. So ventilation is important. I haven't seen specific school by school plans, but I know that is something that we've said is an important thing for each school to consider and each classroom to consider how they can do that, whether it's having classes outside, having more activities outside versus inside, especially at this time of the year and early in the fall, and other ways to increase natural ventilation. I think the other thing that's really, really important that we need to remember about our schools is very similar to what we do in our healthcare system, is that the number one thing that protects us, it protects us if we're going to see our hairdresser, it protects us if we're going to a retail store, is that every single day, every student, every adult who goes into a school has to be assessed, whether it's your parent asking you if you're feeling okay and affirming. We've done it, there's several different ways that people are doing it, but making sure that anybody who's not feeling well is not coming into the school. That's really the important first line of defense that we have, and we know that that works. So ventilation is one of the important things, one of the layers that can help as well.